So I spoke today about the value add of communication for social and behavior change using the work that we do at UNICEF through a core implementation strategy that is part of our programmatic response. And it is essentially about how communication approaches can support the achievement of behavioral and social related outcomes in the context of nutrition, health, water and sanitation, HIV, education and protection. I spoke about some of the challenges that we face in terms of integrated approaches within community health and how communication fits within those approaches. I also spoke about the importance of having a more evidence-based approach to how we work through communications. And I also made some important observations about the need to be more efficient and more predictable in how we use communication within humanitarian response. And I ended my presentation by highlighting some of the key steps that we are undertaking to address some of these challenges, which essentially come together around 3 or 4 issues. One is, how can we as a community be more coordinated in how we do this work? Second, how we strengthen the evidence base that informs our programming. Third, how we develop and apply quality standards that are based on evidence. And fourth, how we bring the field together to be more effective in our investments. I think there was one question about to what extent are we integrating local knowledge into our work, to which I responded by using our engagement in the Ebola response as an example, trying to understand how communities had developed their own ways of protecting themselves until services began to be available and so on. I also spoke about some of the work that UNICEF has co-led in Guatemala to address malnutrition, especially in marginalized and indigenous communities. And it's been a very participatory process where local communities have developed communication plans, have developed monitoring and evaluation tools that bring in some of their own knowledge and perspectives. It's a different way of monitoring, but equally effective. And they've been able to now take it to scale, which is an important aspect of the work that we do. There was another question looking at some of the challenges in terms of funding and investments, especially in humanitarian response, which at the moment is quite a challenge. And I said that most likely our ability to leverage those resources will be contingent upon the extent to which we, partners that work in this field, are able to demonstrate that we are better prepared for emergencies, that we have followed through on the various recommendations that have been made, and that we are working more in a more coordinated manner. And so I think those were 2 key questions that I felt were interesting to the group as well. No one intervention, no one sector, no one approach will be sufficient to drive the kind of social and behavior change that we would like to see in the long term. That we need to come together, that we need to maximize our resources and capacities, and that we also need to think about the fact that for sustainable change, it's important to make sure that people are at the center of what we do. It's not about only changing what people do or how people do certain things, but it's also about making sure that people own the change process, that they are part of it. Of course, we know that it might work differently in different contexts, but the fundamental principle is to make sure that people are at the center of what we do in this area. I think that would be my takeaway message for the group.